Hey everyone, Kendrick McCarty here. Wanted to do a quick video to show everyone how to pull up and administer their testosterone. First of all, when you get your medications, it's going to be in a prescription box. We'll have your specific dosage. 200 milligrams per milliliter is going to be the standard concentration for a man's dose of testosterone. We're going to pop that. You'll see a rubber stopper on the top, which is where you're going to plunge through. This is a 1 milliliter syringe. Your dose will be specifically on your prescription. We don't want to touch the end. We want to try to keep this as clean as possible. This isn't considered sterile, but we want to keep it clean. Every time you open up your supplies, you want to try to keep that exposed but not touched. Bam. We spin it clockwise. It's on. We started with the 21 gauge needle. This is green top. You'll see 21 gauge. The reason why we're starting with this is because it's a little bit thicker and it allows the grapeseed oil that the testosterone is mixed in to be aspirated up a lot easier than a thinner needle. Pull this off through the rubber stopper, flip, and you'll see what we're going to do is just keep negative pressure back on this plunger. You see how quickly that comes up. You can pull much more than what you really need, but you want to keep the needle inside the bottle so anything we push back up is not lost product. So if we're doing, just for reference, half a milliliter, which is 0.5, you'll see that I'm going to push that fluid back up to the 0.5, which are indicated on these little hash marks. All the air has been pushed back into the bottle and I lost no product. That's complete. We're now going to recap that, and there is some product in this hub. We don't want to lose that. Remember, this is kind of like liquid gold and we don't want to get shorted at all. So once we get our dose pulled up, we're about to switch out to a different type of needle, a much thinner one that we're going to inject with. We want to pull back, and that's going to aspirate that extra fluid that's in the hub back into our syringe. We're going to twist this off counterclockwise. We're going to go with our 25 gauge, which is a thinner needle. Open it up, expose the hub, not touch on it. Clockwise. As you can see, the separation between the medication and the air at the top. We're going to slowly push that up until we get one drop come out the top of the needle. And you'll see it just kind of make its way up towards the top. One little drop coming out, that means all the air has been aspirated out and we're ready to rock and roll. Inside your package will come a pamphlet that has the 3 most specific areas for an intramuscular injection, which is either going to be the shoulder or deltoid, the lateral quad, which is the thigh, okay, guys, lateral thigh, or the top corner of the glute. And inside the pamphlet, it'll have very specific areas and show a diagram of how to utilize that. So you can pick which site you want to use. It doesn't really matter. The muscle is going to absorb equally through each one. We want to make sure that you prep the area before you inject. Okay, we have bacteria that lives on the skin. You want to minimize the risk factors for abscess or infection. So make sure you use your alcohol pad, clean the appropriate area, let it dry. Okay, if we were going to do a shoulder, okay, I would prep it. Not that I'm going to inject. We would prep the area, let it dry, go at a 90-degree angle directly in, all the way to the hub. I know that sounds like a lot, but it's really not. Okay, 1 inch. And that's going to guarantee that we get inside the muscle. You're slowly going to push on the plunger. Once you get all your medication in, pull out, take your toilet paper, cotton pad, whatever, kind of do a little massage into the muscle. That's a wrap.